Hello my loves and welcome back to my channel. If you are new here, my name is Ariel and I am a newly licensed registered nurse. I also am a mama of a 10-year-old daughter, so I make videos here for nursing students, pre-nursing students, nurses already, and whoever wants to watch them. So if you like these kind of videos and you kind of sort of, maybe a teeny bit like me too, make sure you hit that red subscribe button down below. That way you never miss an upload from me. And also make sure that you guys hit that post notification bell because YouTube be playing too many games and you don't want to miss an upload. You know what I mean? Anyways, so for today's video, we are going to be talking about patient care techs. I get a lot of questions about this. I know some of you guys are going into nursing school, applying to nursing school, and you want to know what specifically does a tech do in the hospital, if you should be a tech before you go start as a nurse. And I have done a video on this, but I think I'm going to go a little bit more in depth as to what I used to do as a tech and all that type of stuff. So without further ado, let us go ahead and jump into this video. Okay, so if you guys don't know, a PCT is a patient care technician. We work in the hospital underneath the nurses, and basically what we do is we do vital signs, baths, AccuChecks, remove Foleys, we ambulate patients, feed patients. We sometimes sit, which means that if we have a Baker Act, we have to sit with that patient all day or all night to make sure that they don't harm themselves or others. We float to other floors and basically just care for the patient, their general needs. When I first started as a tech, I was just applying to a whole bunch of hospitals, and basically my manager took me because I had my first semester done of nursing school, which is fundamentals. I don't have a CNA license. She took me because I had completed and passed my first year of nursing, my first semester of nursing school, which was fundamentals class. So if you don't have a CNA, you do need to have your, or well, I don't know if that's at your hospital's discretion, but you do need to have at least completed fundamentals class in nursing school in order to be a patient care tech. As a tech, this was my first job ever in the hospital or like in any type of setting like that. I never worked like in a nursing home or anything like that, so it was kind of nerve-wracking. I believe I trained for like about 7 weeks. I worked on nights and I was PRN, so as needed. And for PRN, you have to work at least 1 day a week every pay period. So we get paid every 2 weeks, so you'd have to work at least 1 day a week every pay period. So that was really beneficial, and I was truly blessed to get that position, especially on nights as well, because with nursing school I couldn't work full-time. I couldn't work part-time because full-time you need to work 3 days and part-time I think it's 2. So PRN I can only work once if I wanted to a week and still get some money to be able to pay some of my bills. So I trained, I believe, for about 5 to 7 weeks. I really can't remember. I never trained on days. I went straight to nights, and I've never worked nights before. I used to work 12-hour shifts sometimes, so I knew what it took to work a really long day, but never at night. So that was kind of difficult for me. But I think you just, you do what you got to do. So we start at 6:45. We have to be there at 6:45 p.m. since I do work nights, and we are there until about 7:15 a.m. So right when I go into work, I would go ahead and get report. We do bedside reporting, so we have to go into the rooms, we have to write on the whiteboards, and we get report on our patients. Usually we have anywhere between 8 to, I've had 12 patients before. The minimum, usually we need 12 patients for 2 techs. So if we have less than 12, we get 1 tech, and then if we have 12, we get 2, and I think 21 we get 3, and I think our floor holds 24 patients. So I've had from anywhere to a whole side to myself 12 patients, and I've had as little as 5 patients. So yeah, so I would go in, I would get my report. We have little papers that we can write down on each page. Usually in report, what I tell the next tech is how this patient ambulates, what their diet is, how they eat, how they use the restroom, so if they have a Foley, if they use the bedside commode, if they have any wounds or anything that they need to be careful about, any JP drains or anything like that. That's what I let the oncoming tech know, and that's usually what they let me know as well. So after report, I go ahead and I wipe down my WOW. We have WOWs, so they're computers on wheels, and I wipe it down. I desanitize because you don't know who's been touching it, and in the hospital it's disgusting, so I always disinfect all my stuff, my phone, everything. And after that, I go ahead and I look at my patient's charts just to see if the tech has missed anything or anything like that, anything that I need to know extra, like if they're an AccuCheck or anything like that. So once I finish all that, I start to do my vital signs. Now, vital signs are done on my floor at 8, 12, and 4, but we can start them a little bit earlier. So I usually start mine at 7:30 because this is the time where I want to make sure that I get to spend enough time with my patients. I'm just meeting them, so I want to spend more than 2 minutes with them getting their vitals. So I start early, that way if I have a bunch of patients, I can get done in a timely manner. So I'll go in, I'll clean up their, little table. If they have a mess, I'll ask them if they need any water, if they need to go to the bathroom, if they've had a bath, and I'll do their vital signs. I'll chit chat with them, just to get to know my patients. So I'll be doing that till about, as long as it takes me. And then after that, it's really just answering call lights. It's if somebody needs a bath, I give baths if they didn't get a bath during the day. If somebody needs to go to the bathroom, if they didn't while I was in there and then now they need to go. And yeah, until about, 12 o'clock until about like 11 o'clock or 11:30 when I go and start my 12 o'clock vitals. Usually after 12 o'clock is when it slows down. Nobody really calls or anything. And that's at the point where you start to get like really sleepy. You got to keep yourself busy. So I'll go ahead and I'll go into all my rooms, make sure that they all have suction, make sure that they all have STDs, make sure that things are stocked up, if they need gloves, if they need this. We do hourly round on our patients at my hospital, so I have to go in there every hour and check on them. So if they're sleeping, I just peek my head in so my badge goes on the TV so they know that I've been in there. If they're not sleeping, I'll talk to them. Sometimes I have very needy patients and they need something all the time, and I know that can be frustrating, but that's what it is. And you just have to understand that, this is probably a difficult time for them. And yeah, so I tend to my needy patients. Sometimes patients just want to talk. So sometimes I've been in patients' room for like an hour just talking to them. And I don't mind listening to them because I know that they just need somebody to talk to and listen to them. So I really don't mind and I like doing it. So yeah, so after I do my 12 o'clock vitals is when it gets really slow. Sometimes if I have like incontinent patients, sometimes I'll be in there every hour or two changing them, cleaning them. If my patients have Foleys, I empty their Foleys every time I go in there to do vitals. So at 8, 12, and 4, and you have to make sure that you chart that. You do need to make sure that you chart anything that you do, because if you didn't chart it, it wasn't done. So if I've given baths, if I've taken a patient to the bathroom, if I've given them water or juice, an evening snack, if I've done their blood sugar, I make sure that I catch up on all my charting because that's very important. I can't lie, there is downtime on night shift and I'll just read or try to stay awake and watch some YouTube videos or whatever, or socialize with my coworkers if they're coworkers that I, socialize with. If not, I'll just sit in my little corner and chill and try to stay awake. I usually go to lunch at about 2:15, 2:30-ish, and we have 30-minute lunches, so I'll go and do that. Sometimes I'll like rest my eyes for like 5 minutes, but I feel like that makes me more tired, so usually I'll just go out into the lobby and watch some diners, drive-ins, and dives and eat my lunch and then go back. I like to go at that time because then I only have like an hour or so when I have to start my 4 o'clock vitals. And then I start my 4 o'clock vitals at about 4. I try to start them as late as I can. That way, I can take my time and the time will go by quicker. Yeah, I do my 4 o'clock vitals around 4:15. It depends on how many patients I have. So I just, evaluate like that. Sometimes we have patients that are, like I said, incontinent. So we would just want to bathe them before day shift comes in so they're nice and clean for the day and stuff. So I'll do that if I have to, or change any other patients. Usually if it's a 2-person assist, my nurses help me. So that's great because I have really great nurses. So that's very beneficial. So then it's just a waiting game. And usually I'm just like, if I'm not doing anything, or if I floated to another floor that's like really not that busy, like the other day I worked, I'll just be there like falling asleep trying to stay awake, because sometimes you just don't have anything to do at night. Sometimes all your patients are asleep and chilling and you ain't got nothing to do, and you just like, damn, when am I gonna go home because I'm about to freaking pass out right here. No joke. But yeah, so then At that time, the next tech comes in at about 6:30, 6:45, and then we give report and then we leave. Sometimes we do have really busy nights where we're discharging patients right at shift change, or we're getting patients right at shift change. So every day is different at the hospital. You never know what can happen. So it's just all about prioritizing the needs of the patients. But like I said, it's all about prioritizing the patients. Like if one patient is calling because they're dirty, they wet the bed, and then another patient is calling because they want a cup of water, it'll probably take me 2 seconds to get this patient a cup of water, so I'll go get the cup of water first and then go ahead and take my time in cleaning this patient. Now if I have 2 patients that are dirty, I mean, it's which one can wait longer, or which one, you know, isn't in dire need to be changed right now. And if not, you utilize your coworkers. I mean, that's what they're there for, to help you out. But it's all about prioritizing, you know what I mean? If I'm getting a new patient and I'm in the middle of vitals and I need to go and hook up this patient on the monitor, it's call your other nurse, call your other tech, let them help you out, because that's what they're there for. We're all here as a team and we're all here to help each other out. So I definitely suggest, you know, you get to know some of your coworkers. It doesn't mean that you have to be friggin' best friends with them. I'm not best friends with all my coworkers. I am friendly and I talk to all of them, because at the end of the day, we're all a team and we're all here to help each other out. And the patients are the #1 priority. If I'm not busy and my other tech is busy and their lights are going off, then I'm obviously gonna go over there and help out the other tech, whatever they need. I mean, some people I know aren't like that, and that's perfectly fine, whatever. I mean, I can't say that I've never been spiteful and been like, all right, well, I'm not gonna get your lights because you don't get mine. But I mean, I have, but at the end of the day, it's all about the patient and it's about helping the patient out. You know what I mean? Like I said, it's all about prioritizing. If you've never been like in the healthcare field before, it is gonna take you some time. I remember when it was my first night to start alone, I was so freaking nervous. Like, I did not want to start alone. I thought I didn't know anything and I was just so scared. But you know what? You got to do it. You really do get used to it. Don't stress yourself out. You know, it's all about time management, all about prioritizing, like I say all the time. So definitely don't stress yourself out about it. You'll get it. And, you know, just know that you can rely on your coworkers and that they are there to help you out. Now, as far as do I think that you should be a tech before you are an RN or while you're in nursing school? Hell yes. I mean, I think it's really going to tell you let you know what it's like. And I think, you know, it's very beneficial. You learn a lot while you're in the hospital. You learn lots of different things, and the nurses like to teach you things if you have a good hospital. So I definitely think that you should be a tech or a CNA or something. That's not to say that, oh, you know, I can't be a nurse if I've never been a tech. No, but if you can, if you have the opportunity, then for sure. Yeah, I hope this video answers some questions for you guys. If you have any other questions about techs and what they do and anything like that, go ahead and leave them in the comments down below. If you like this type of video, make sure you give it a thumbs up. I would appreciate it. And I will see you guys in my next one. Bye.